Cool FM live on location at Kohif TailorHealth here in Sierra Vista, 3533 Canyon de Flores, Suite A. Dr. Kohif joins me right now. Dr. Kohif, thank you so much for joining us today. Today, talking about Kohif TailorHealth. First of all, what is precision care? Because that's what you do.
First of all, thank you so much for coming by, and I appreciate your support and for the community as well. And about us, I know probably people know about us now. We've been here for 2-3 months now, and we established in Sierra Vista the first precision medicine center. So the question is, right, what is precision medicine? We know that traditional healthcare usually, treatment or care is delivered based on the average patient, So, however, we know that we are unique. Patients are unique. Everybody's different, right? Your genetics, are different from from other people. Lifestyle, environmental exposure, medication profile, medical history. So all these different, I would say, unique patient characteristics, they are unique. And that's what precision medicine is all about. It's all about really tailoring care to suit your needs. Right? A care that takes into consideration your genes, lifestyle, environmental exposure, and so on. And this is why we established the first precision medicine center here, because we believe that care should be unique and no more one-size-fits-all care.
And as far as the genetic tests go, talk about the type of genetic tests that you offer.
Yeah, when it comes to genetic testing, there is a wide range of genetic tests that we could perform. Tests that cover medication response, why people would, respond differently to medications, because sometimes, we might take a medication that works for you, but doesn't work for somebody else, or it causes problems for you when, it doesn't cause for somebody else. So that's called pharmacogenomics. So that's one of the tests that we cover here. And the other test is called nutrigenomics, and that test covers a lot of things. Nutrition, weight management. It tells us a lot of information about, how your body processes food, and also how food influences your genes in your body, right? Ours tells us if you're in risk to develop certain conditions like type 2 diabetes and many other things, really. So, and there are many other tests. The applications of the genetic tests we perform here are, I would say, that across a lot of specialties. One test we're actually going to have soon is called cancer genomic tumor molecular profiling, which is very interesting, and it's going to be probably new to Sierra Vista and maybe Arizona. And that test, the goal is really trying to get people away from chemotherapy, like cancer patients, get them from chemotherapy, because we know that chemotherapy causes a lot of problems. But the goal is to be able to develop and provide recommendations for the oncologists that would just work, on finding treatments that will target that specific genes that's causing the cancer, instead of just giving randomly, these different chemotherapy. Yeah. So,
what is the process for somebody to come in, and as far as the specialties overall that you cover?
Sure. So, for somebody to come in, we offer free 15 minutes consult or visit. You can do it virtually. You can do it on site here in the clinic, and usually it's just, educational session, informational first of all, to make sure that you are actually a good candidate for those tests and for our service. Everybody's a good candidate, right?
Yeah.
But of course, it's always nice to inform people what they're getting into, right? So that's how it is, 15-minute consult on site or virtual. And then if we proceed, then we'll start with, genetic test. Then it's a simple cheek swab that we do, and we send it to our lab, and within 2 to 3 weeks maximum, the results will be received, and then we will schedule it up for a result follow-up to discuss findings, and then our experts in PGX and precision medicine can help you and your providers actually to develop I would say a tailored plan for you. In terms of a specialty, we cover probably almost all the specialties. That pharmacogenomic test that can tell us how your body processes medications, and help you avoid any side effects, adverse reactions, and things like that. The coverage is wide. We cover almost 17 specialties like cardiology, psychiatry, oncology, pain management, and you name it, And the good thing about it, this is it's a one-time done test almost, meaning that you won't have to redo the test. So your data is going to be with us for lifetime. And whenever you're about to be prescribed the medication, or if you want to know about the medication, how you're going to respond to that medication, for example, then you can just inquire our portal, our system, and we'll tell you what to do. And any new medications that will come up in the future, if any new medication comes out covered by these genes, then your data is going to be updated automatically. So you won't have to redo the test again. Yeah.
All right. Excellent. And doctor, any, as far as coverage goes, insurance, you want to talk about payment, things like that?
Yeah, so I mean, insurance is still a big challenge, right? Because when it comes to genetic testing, unfortunately, insurance is not covering it. Some insurance carriers, like I would say Medicare and some others, might cover some genes, but usually it's not covered. So we have our own financial plan and models in place where we work with people. We have different tiers, starting from 99 all the way to 599 and 799, depending on the coverage you like. I mean, it's still much cheaper than other genetic test providers. I mean, like you can go for thousands of dollars just to get coverage for such a genetic test. Yeah, so we do have our financial plans in place. We never want finances to be a barrier for anyone. So that's something that, I mean, it's a mission of our company. We try not to let financing to be a barrier to tailored patient care.
All right. Located at 3533 Canyon de Flores, Suite A, here in Sierra Vista, Kohif TailorHealth, ready to serve you here in Sierra Vista and Cochise County and all across southern Arizona. Any final thoughts, Doctor, before we go?
Well, first of all, I want to thank you again, and then I want to thank the community so far. I would say throughout the past 3 months, we had wonderful patients. We still have patients coming, to the clinic, and we appreciate people trusting us and our services. And one last thing I want to mention is, it means everything to us when we see somebody who's been, dealing with, I would say, provider or switching providers, switching medications, trial and error for years. But then when they come here, for example, somebody with blood pressure, we have people, they had high blood pressure for years. And when they came here with the insights we delivered to them, they were able to get their blood pressure under control. Same thing with diabetes, cancer patients as well, to reduce the chemotherapy effects and things like that. So that means a lot to us, because this is a mission, really. We want people to have healthier life, and not just reactive type of medicine also, but preventative measurements as well. That's why we cover those genetic tests that can help you on the wellness side and prevention side as well, to know if you're going to develop something in the future. This way, you don't have to go through, and then after the fact, you come to us. So we'll try to prioritize prevention as well. So I want to say that thank you again for people who trust us, and we're more than happy to serve the community in service and the surrounding areas as well. I don't want to forget anyone. We have people from Hereford, Benson, Tombstone, I mean, you name it. So but thank you so much.
Kohif TailorHealth, ready to serve you. All the information in the post description of this video. Thank you so much, Doctor, for joining us.
You're very welcome. Thank you so much.